Hello, Enid, and welcome to another update of the coronavirus disease, also known as COVID 19. My name is Derek Silas, the Communication Director for the City of Enid.
And I'm Diana Hernandez, Communications Assistant for the City of Enid.
Our guest today will be from Integris Bass Baptist Health Center, Finney Matthew, the President, and Vice Chief of Staff in Pulmonary and Critical Care, Dr. Brian Whitson.
And from St. Mary's Regional Medical Center, CEO Krista Roberts, and hospitalist Dr. Sarah Odom.
I want to welcome you all to our program.
Awesome.
Thank you for joining us.
Thanks for having us.
Thank you. We're glad to be here.
Thank you.
Okay. Well, we're going to jump right into some of the questions that a lot of Enid residents are asking us or really want to know about. The first question I will ask, I'll start with Integris. How has COVID-19 affected the hospitals?
Yeah, I think the major disruption of supply chain has been huge. We're concerned about personal protective equipment, the masks and gloves and respirators that caregivers wear to take care of COVID-19 patients. I think the change in our visitor policies has impacted us greatly as well. You know, we love celebrating memorable moments with our patients, whether it be finding out you're free of cancer or the gender of your baby. And some of those are a little more muted with less visitors in the building. We're very much like some of the small businesses around town. We may have a large building, but we see some of the same issues related to cash flow and having to low census some of our caregivers because of the change in business. We're not doing elective cases right now on the recommendation of the federal government and CDC. And so that's changed the number of people we have in our building. And traditionally, that's a huge way that we generate revenue for our facility. Now we're focusing more on the inpatient, which is our COVID-19 patients.
Okay. Can you answer that same question, St. Mary's?
Sure. Well, I would echo a lot of the comments that Finney mentioned. Obviously, we're both in this and certainly impacted in very similar ways. I do want to reassure everyone that both hospitals have very thorough emergency management plans. This is something that we go into quite frequently. When we saw what was going on over in Wuhan, China, as we watched that spread across the globe and certainly into the U.S., immediately we began to begin reviewing that. The emergency management plan includes a pandemic plan. It also includes a patient surge plan. So we immediately began drilling with our leadership team on that. And we have never stopped since then. And that started back in February. And we've just continued at a pretty rapid pace, a very rapid pace since then, just to ensure that we have done absolutely everything that we possibly can in terms of preparation for this, if in fact we have a surge event in our community.
Okay.
We've been told in terms of interruption. Finney mentioned our supply chains have been disrupted. Everyone in healthcare is probably aware of this, but for our community members, 80% of our isolation gowns are manufactured in China. So when that distribution got cut off, obviously that caused a very abrupt supply chain issue. And so we are being told at this point in time to expect up to a 6 to 8 month disruption before supply chain resumes to normal. So that's been challenging for us. We are optimistic that there is some production that has come back online in China, but as of recently, what we are understanding, what we're being told from vendors, is that manufacturing is being retained in China itself, so it's not leaving the country at this point in time. So we are creating a situation to where we can be self-sufficient, and we're all trying to be very good stewards of our personal protective equipment, which in healthcare is what we reference as PPE.
Okay. So this is another question. What preparations have you done as far at the hospital far as COVID-19? And I can start with you, Mr. Matthew.
Sure. So we have, as Krista said, multiple plans in place already that we drill and practice for on a regular basis. Specifically to COVID-19, we have people dedicated to working on supply chain and obtaining the materials we need for our caregivers and frontline staff. We've restricted visitors into the building to protect visitors from each other. patients that are already here and caregivers from being more exposed. We've set up a dedicated unit to take care of any COVID patients that we receive. Again, we're trying to segregate that population to keep as many people as healthy as possible. We are cross-training staff so that if you have someone like me who typically works in a business environment, I may be trained to give patients baths or other bedside caregiver tasks that we can do in order to preserve our staff and our highly trained nurses to do nursing specific tasks. Inside the building, we're practicing social isolation. This is the closest I've been to another human being in about 2 weeks. We're actually, our leadership team as a whole has split up. So some of us are working in other buildings so that in case one of us gets sick, we don't infect the other so that we can continue business operations. And then again, we drill. We drill over and over again and stress test our systems to ensure that when the surge comes, that we're prepared to take care of as many of Northwest Oklahoma citizens as possible.
Very good. And can we have that same answer, that same question for you, Ms. Roberts?
Sure, absolutely. You know, as far as we're concerned, very similar situation. It's pretty much all hands on deck at this point. We've continued to go through different scenarios with our team. We've also restricted visitors with very limited exceptions. We do have a designated area that we have identified. We have 2 additional overflow units that we have identified should the need occur. We have also been focused on increasing our negative pressure rooms, our negative air pressure rooms. When we have all this in place, we are very close to having the final piece in place. We will have moved from 3% of our patient rooms having negative air pressure up to 35% of our patient rooms will have negative air pressure. So that will be very nice to have. The main thing with the negative air pressure is basically that air leaving the building is going through HEPA filters. So it's essentially scrubbing it before it gets out into the air. It's not being recirculated within the hospital. Also, we've significantly ramped up our ventilator capacity. That's been something that you've seen, you've read about in the news, that some facilities, some pockets of the country have had a significant increase in the demand for patient ventilators. We have a 250% increase as of today in our ventilator capacity should the need ever arise. And to kind of put that in perspective, I have been here 30 years in August, and we have never come close to that number in the past. We've never had a need for that, but we are trying to be as prepared as we possibly can, not knowing what the exact demand will be.
Okay. Well, we have a few questions for the physicians, the doctors. I'll let you take some of those.
For Dr. Whitson, how does COVID-19 spread and what are the symptoms?
So the 2 main routes of spread are airborne or aerosolized. And so that's why we're talking about social distancing, because if somebody coughs or sneezes, those viral particles enter the air and we can inhale those particles and become infected that way. The other way is by droplets. And so, you know, and depending on what surface the virus is in, it will survive for a different length of time. But let's just say, for safety's sake, the virus can survive for hours on most surfaces. And so that's why there's the big emphasis for hand washing and using the sanitizer as much as possible. And also there's a recommendation for cleaning surfaces with agents that will kill viruses. As far as the symptoms go, it's very similar to the flu. So we have fever, cough, upper respiratory congestion, and you can have shortness of breath, certainly if people have more severe symptoms. And there's been some discrepancy to can people have GI symptoms or not, like nausea. And the statistics are about 10 to 20% of patients can have some GI symptoms. So, you know, just because you've got GI symptoms doesn't necessarily mean that you don't have an infection with the coronavirus. It's unlikely, but so those are some of the things to consider.
Okay.
Thank you.
Dr. O, well, when should a person seek medical attention if they think they have symptoms of COVID-19?
Right. So some things to look out for is you have an increase in your shortness of breath, if you have an increase in your cough, if your symptoms start to worsen, they will worsen as the infection goes on. Anything like that, definitely call your healthcare provider, and they will direct you to either possibly do a telemedicine visit. I know several people are moving towards that, or direct you to seek a higher level of care, like coming into the emergency room.
Okay.
All right, and question for Dr. Whitson. Everyone who is experiencing symptoms, should they get tested?
Well, that's a great question, and I'm sure at both our emergency rooms we've had people present because they have flu-like illnesses and they want to be tested. The truth of the situation, at least in our area, is there is not an overabundance of test kits, and so the CDC gives us a priority of who should be tested. The highest on that priority are patients that are symptomatic, meaning they're having symptoms likely to be explained by coronavirus, and they are sick enough to require hospitalization. That's our number one priority. The next priority would be people that are at high risk, so they have corona-like symptoms, but they're at risk for having worse disease. So people that are over 60, especially have the comorbidities like diabetes, heart disease, if they for any reasons have any reasons that their immune system wouldn't function properly, those are the next group of patients. And then there's a priority or hierarchy of patients that should be tested after that. The lowest of the priority is somebody that doesn't have any symptoms at all. Those people shouldn't obviously be tested. I know we see on TV with the politicians, I don't know how they get tested, or the Utah Jazz gets tested. I haven't quite figured out where all these tests come from. Nobody could answer that for us. But as far as reality in Garfield County is, you've got to be pretty sick to be tested. And, we've tried to discourage patients from coming to the emergency room unless they're sicker and may possibly need hospitalization. So I would say that.
Okay. Mm-hmm. There's a lot of concern about restaurants and gyms closing. I'll pose this to Dr. Oldham. Why is there a need to close the restaurants and gyms? And can you speak to the need of the social distancing?
Yes, social distancing is very important. Like Dr. Whitson said, this is spread aerosolized. You can inhale those droplet particles. The droplets stay on surfaces. They stay active on those surfaces. So closing places like restaurants and gyms where people might wipe their nose, they might sneeze, they might cough, those particles are going to land on things that other people are touching. And to reiterate again, some people might not be symptomatic. So you could be feeling okay, you could still be shedding those viruses on all of these surfaces. And so to decrease the spread, it's very important for social distancing. And social distancing, like I said, this is the closest we've been in weeks. We've been working really hard for weeks on all these changes that we've made, and how important it is for hand hygiene, social distancing. And that's not just restaurants and gyms. That extends to play dates if you have young kids, going into other people's houses, if you have a cleaning service that comes to your house. Limiting contact to all of those things that we have in our everyday life is extremely important until this, so we can flatten the curve as much as possible, basically.
Okay. So maybe both of you guys can answer this question. What can we do as a community to help prevent or slow the spread of COVID-19? And how can we help our hospitals? Mm-hmm. We'll start with Integris.
Whitson?
Well, I think the biggest thing, and what I'm counseling my patients and really friends and families is I don't know if this is an Oklahoma word, but I'd say hunker down, just stay at home, and really only go out when you have to do vital things. And I think that's the biggest thing we do is to try and maintain isolation and exposure. And then if people are sick, if somebody is sick in your household, isolate, and obviously if they get more severe symptoms and they need to come to the emergency room, go to the emergency room and let's get them checked out. But if they're not that severe an illness, is isolate them. And actually there's information on websites on how families should take care of loved ones that might have the coronavirus at home. And so I mean, by far, that's the number one biggest thing that we all can do for each other. And just, I would just throw in there, just remember, it's just because you're young and healthy, and I'm old now, but for, but if you're young, that doesn't make you immune to getting sick. And they showed a patient on the news the other day that was 25 years old, robust, healthy, and they're very sick on a ventilator in the hospital. And so just because you're young and healthy doesn't mean you're immune to getting really sick. The other thing is think about other people. Just because you may not get very sick, that doesn't mean that grandma can't get really sick and perhaps not do well and pass. And so the isolation, we just have to think about not just ourselves, but our community and our relatives and friends.
Okay.
And I would say on the hospital, thank you to the community who's reached out and has provided donations as we've needed them. We appreciate that. And I would say stay in touch with our Facebook page and we could put out needs that we need and appreciate the response thus far.
Okay. St. Mary's?
Yeah, I wanted, Ashley Williams, you've kind of brought up some good points about play dates and kids. So outside play is okay. It's outside in the open environment. What I would stay away from, close contact. So if you have a big neighborhood full of kids and there's a bunch of kids playing in the same place and they're dogpiling on each other, hugging each other, being kids, I would really limit it to, if you have siblings or your own kid, try to stay to yourself as much as possible outside. Of course, you can go outside and ride your bikes and everything like that, but in your own family unit is what I would suggest. I would also stay away from parks, all those surfaces that these droplets can survive on. Stay away from those communal areas still. And I feel you. I have kids myself, and we are stuck to our neighborhood outside in our yard, and it's very hard. And I understand we've canceled play dates, we've done the whole rigmarole, but I promise you it is worth it to social distance.
Mm-hmm.
Yes, and I would just like to echo thank you to all the community partners who have really stepped up, reached out and said, hey, I've got this. It's not in large quantity, but I've got this. Everything helps. We put that together, and cumulative, it all makes a big difference. I also want to kind of hit on a point. People tended to get extremely anxious, kind of panic when all the hand sanitizer in the community disappeared. Soap and water is a great thing to be using right now. We're using that in the hospital in conjunction with hand sanitizer, but that is something everybody can do at home. And last time, it's been a while since I had a chance to get to the grocery store, but last time I was there were plenty of bars of soap. There was plenty of just regular soap. Yeah. That's something everybody can be doing in their own homes multiple times a day that will help as well. I would also like to say everybody in healthcare right now is just working extremely hard, working a lot of extra hours. We've got people doing working extra hours in their departments. We've got people that are working in roles that they've never worked in because they're willing to do whatever it takes to help everybody, help our community get through this. If you have friends and relatives that work in healthcare, now's a great time just to shoot them a text message, send them an email, and say, hey, thanks, because people will be getting tired. I remind our staff, this is a marathon. This is not a sprint. At this point, we don't see the finish line in sight, so we know that we've got a long road ahead of us. We are hoping that the actions that have been taken to date in terms of reducing some of the possible exposure through our social distancing and reduction in business hours will definitely help flatten the curve. But we know that this is not something that's going to be gone at the end of this month. So I would just like to say that this is a great time to thank some of your healthcare providers.
Okay, we appreciate it. Mr. Finney, do you have anything else to add? Any last words?
No, I think Krista sums it up really well, and I would say that I hope the community feels secure in the two hospitals that are providing care here in Enid. We're working closely together and talking to deliver the best quality care and outcomes we can provide for the community.
Okay. Well, we appreciate both of you for joining us today to keep the residents in the city of Enid, just what's going on. And we appreciate it.
Thank you so much.
Thank you so much. Okay.
All right. Thank you.
And we want to say to our residents and our citizens that we will have another program tomorrow, and it will be the Garfield County Health Department. So join us tomorrow, and we want to thank each and every one of you for joining us Monday through Friday always 1:30 p.m. for just an update of what's going on in our community. Thank you.
Thank you.